Ladies and gentlemen, I know the urge to go for a quick break, a cup of coffee, to start chatting with your neighbor is almost too hard to suppress. But we must press on with our program. So for those of you who are interested in the next panel, I would ask you to take your seats as I ask the panelists to join me on this table. My name is Martin Reiser. I am the country director of the World Bank here in Turkey. And I have the pleasure to be the chair for the next panel, which is going to look at the economic prospects of aging, both the opportunities but also the challenges that we must face as societies age from an economic point of view. And to help us discuss these topics, I have three panelists today, two ladies and one gentleman, and I'm going to start by asking Dr. Emily Sinnott to come and join me. Emily is a senior economist in the Human Development Economics Unit of the Europe and Central Asia region at the World Bank. Emily is also one of the leading authors of a new flagship book on the economic prospects of aging in the Europe and Central Asia region with the preliminary title To Live Long and Prosper. And I'm sure Emily is going to tell us just how to do that. Next, I would like to invite Dr. Dörte Dömeland, also from the World Bank, to the podium. Dörte is also a senior economist in the World Bank, but she works in a different unit, also in the Europe and Central Asia region. Dörte has previously worked on issues of debt management in low-income countries in the Development Economics Research Group in the World Bank, and managed a debt relief facility for the World Bank, and will be focusing in her remarks particularly on the fiscal and macroeconomic aspects of aging. And then last and not least, I would like to invite Mr. Dalman Hoskins to the podium. Dalmer is presently working as the director of the Division of Economic Analysis and Comparative Studies at the US Social Security Administration. Prior to that, he held various positions in the US administration, and I believe has also been involved with the UN International Labour Organization in Geneva. Once again, a warm welcome to our three panelists, and we shall go into, without much further ado, we shall go into the first presentation. We will have three sets of presentations with some slides, and I would ask each of the speakers to keep their presentations to about 15 minutes so that we have ample time for discussion with all of you here in the audience. So thank you very much. All right, we will slightly change the order, and we will start with Dr. Dömeland.
Okay, thank you very much. My presentation will focus on the macroeconomic impact of aging.
I don't think your microphone is working, or you need to speak closer to it.
Can you hear me now better? Okay. My presentation will focus on the macroeconomic impact of aging, and I'll be using the example of Bulgaria. Now you have to bear with me. Which is undergoing a quite extraordinary demographic change. Within about a century, Bulgaria's population pyramid is going to change from a solid pyramid, as it was at the beginning of the 1950s, to something like a globe. That's its current shape. And by 2050, the pyramid is going to look more like a vase than a pyramid. And that is because of two major demographic impacts. One is the aging, and the other is the out-migration, especially of young Bulgarians. So in the course of only 3 decades, Bulgaria has become the 3rd oldest country in Europe and the 4th oldest country in the world, right after Japan, Germany, and Italy. Bulgaria, of course, is a much poorer country than the other 3, and so this imposes significant challenges on the government to provide the services the elderly population needs. Also, the speed of Bulgaria's demographic change has been much faster than in all the other countries. And so Bulgaria's institutions had much less time to adapt to these new demographic challenges. Now, going forward, Bulgaria is projected to face the steepest decline of any country, of its working age population of any country in the world, losing about 45% of its working age population by 2050. So this means that by 2050, 1 in 3 Bulgarians is projected to be older than 65, and only 1 in 2 Bulgarians will be of working age. So we think that raises 3 important questions, many questions, but the key, that can be kind of put together under 3 important questions. First, what does this mean for future growth? How will this affect public finances? And how can the needs of the elderly be met? And I'm going to skip the 3rd part because I think we will be talking, and we have been talking a lot about this 3rd point, and I'm going to focus on points 1 and 2. Now, first of all, we think that without policy actions, growth is likely to slow down. And why is this the case? It's simply driven by the fact that the working age population, or the labor force as a size of the total population, is a key determinant of a country's income. So as the labor force as a size of population declines, growth is likely to slow down. And in Bulgaria, we saw that the labor force as a share of population increased till 2008. So there was actually a positive demographic impact. But since 2008, this has started to decline, and going forward, it's going to become worse. So one way to stem this decline, of course, in growth is to increase productivity. So how is demographic change going to affect productivity growth? I mean, my stance is we don't really know. There's not really very much convincing evidence at the micro level that aging will affect productivity, unless perhaps you are a professional soccer player and your productivity in terms of scoring goal declines at what many probably would perceive a relatively young age. At the macro level, it's even more difficult to say, because economies may adjust over time as the share of people, elderly people in the population changes. The structure of the economy may shift towards the production of goods where elderly people are more skilled and better prepared. So it's very difficult to say at that point. Moreover, for example, younger people may have more incentives to invest in education as their life expectancy increases, simply because they have more time to reap the returns of benefit from education. Or resources may free up in terms of investing in education as this number of students declines in a country. So bottom line, any policy action that helps to boost productivity growth will help, because if the labor supply declines but workers are able to produce more with the same number of workers, that will be good. But how the demographic change itself will interact with productivity growth is very difficult to say at this point in time. So we think one thing that will definitely be important is to invest in education to keep this aging workforce productive. One thing in this context is important to invest in good basic education, because workers that have better basic education can more easily be trained in the course of their working life. The second important aspect in the context of aging is improving lifelong learning. And if you look at the graph below, Bulgaria is right at the right, like the little tiny red dot you see on the right end, that's the share of Bulgarians participating in lifelong learning. So it's a very, very low part of the population currently engages in lifelong learning. Now on the left side of the graph you see Denmark, and Denmark had a quite spectacular strategy in terms of scaling up lifelong learning. And they basically focused on 4 pillars, on improving or providing high quality basic education, on providing publicly funded adult training, on involving all the key stakeholders in the process of designing, and in focusing on the groups with greatest needs. So there are good examples out there from which countries like Bulgaria could learn. The other important aspect is of course an efficient health sector, and I think Emily is going to talk more about this. But an efficient health sector is very important to keep the citizens long, to ensure that they have long, healthy, and very productive lives. And we did an in-depth study of the Bulgarian hospital sector and found, for example, that in 55 out of 275 Bulgarian hospitals, 1/3 of patients could be treated on outpatient basis according to international standards. So in the Eastern European, there's a very hospital-centric health system, and that often doesn't allow the people to receive the good quality care and the services that would allow them to treat at a much more efficient basis. Now, one could look at productivity growth. The other side to look is and see, okay, what can be done on the labor side in terms of increasing labor force participation rates? And when one looks at Eastern Europe right now, actually interesting labor force participation rates have been declining since the beginning of the 2000s. Now, the challenge here is that even under the most optimistic scenario, and my colleague Johannes Köttl, who is sitting here in front of me, did a lot of work on this, very interesting work, and he was able to show that even under the most optimistic scenarios that you can think of, like if Bulgarians would have the labor force participation rates of those countries with the highest labor force participation rates in Europe, like Switzerland or Iceland, if retirement age would increase by 10 years, if women would have the same labor force participation rates of men, so if you have a maximum scenario, even under these circumstances, it would not be able to stem the decline in the workforce. The only game changer here in that context could be migration. So what is the big question is going forward there in the context of how the labor force will actually evolve is how migration flows will change over time. Now, on the public expenditures, we think that over time they are likely to increase. And that is simply because as people age, demand for certain services such as pensions, health services, and long-term care is likely to increase. And we estimated the costs of the hospital costs by age group for Bulgaria. And what you see here is an index where the costs for the group of people aged 40 to 49 is normalized to 1. So what you can see is that people aged 70 to 79-year-olds have more than 3 times higher hospital costs than people in the age groups 40 to 49. So if people become old, or the population becomes older, more people will be in the age group that has a relatively high hospital costs, and that will put upward pressure on public expenditures. The same holds, of course, for long-term care. And pension, I'm not going to touch down because we could talk for hours about that. So overall, we see, on the other hand, there are some expenditures that those countries that go through population aging are likely to be able to save on. One is education. So normally, and we see this also in Bulgaria, the student numbers decline. So education expenditures will fall. And so the question is the increase in expenditures on health, long-term care, pension going to outweigh the savings in education? And there can be other costs. For example, on securities. In the US, there are studies that project that expenses on prisons are going to go down because as people are older, they're less likely to commit crime, and so there's less need to maintain prisons. Overall, we project for Bulgaria that the overall impact was such that public expenditures are going to rise and that over time, public debt is going to build up in the absence of reforms. And private savings? Private savings is one of these big questions. We know that at the individual levels, the savings behaviors change as people age. Normally, people change during their working lives, and they just save when they're old. But whether this necessarily means that aging populations save less, I think it's a big question mark. So there is, according to standard life cycle theories, it would mean yes, that savings decline as population age. But there's empirical evidence that this is not necessarily the case because individuals can, for example, increase savings with life expectancies because they want to finance consumption during their retirement. And there's a big gap between what we observe in terms of macroeconomic cross-country regressions, where we actually find that saving declines as dependency ratios increase. But when you look at microeconomic level, it's not so clear, and also time series analysis doesn't really give us a good sense that savings are going to decline as the share of the elderly in the population increases. So for example, we just did some work in Poland, and we find that these age profiles are actually not that hump shapes, as the age savings profiles are not hump shaped as we would usually assume. In fact, it's people aged 29 to 39 in Poland who save the most. And that's because you also have cohort effects. The younger now probably face much more uncertainty. They're worried about their pensions, and they just may start saving more now at an earlier age. So bottom line, it's a very relevant question to see what's going to happen with savings, but there is no clear-cut answer yet, and it will very much also depend on the country-specific circumstances. So bottom line is that we think, in the case of Bulgaria at least, in the absence of reforms, population aging is likely to depress growth and increase public debt. But as I said before, the impact on debt, on public financing, again, depends very much on the countries. Many of the reforms that could help to mitigate the impact of aging work because they change the behavior of the people while they are at work to ensure that they have a better life when they get old. Think, for example, about reforms in the labor market, things about pension reforms, reforms of the healthcare system, improving preventive services, works now with the young and can ensure that they don't have chronic diseases when they get old. So it is thus important that starting to think about implementing these reforms at an earlier stage. The earlier these reforms are implemented, the earlier the elderly of the future will be able to benefit. Thank you.
Thank you very much. Thank you very much. It's a dire picture, if I may say, at least for Bulgaria. They're going to have to do quite a few things. But I'm sure that Emily will cheer us up by telling us that there are lots of countries where we have concrete examples of what can be done. So Emily, the floor is yours.
Okay, thank you very much, and thanks to everyone for coming to listen to a panel of economists after lunch. I hope that this presentation doesn't contain too many equations. In fact, I sought to have none. It's more pictures. And what I wanted to present here today was a little bit the context of our work program, and here we're focusing very much on emerging Europe. The background being the human capital story that faces the population at large, but in particular the focus in this presentation is on the older population. And then talk about some solutions that are emerging to the challenges that an aging population poses. We want to get away from the doom and gloom story because the countries that we work with are not so interested in hearing more of that. They want to know about solutions, policy interventions in other countries, things that should be tried. So we've talked about Bulgaria and very much the challenges they face and the type of policy framework that the government is formulating with this type of diagnostics in order to meet the aging challenge. And here I'm going to go a little bit broader and show a little bit how Bulgaria and the other emerging European countries look like in the context of those already advanced economies in terms of incomes who have been hit by aging populations. So first of all, what we're seeing in emerging Europe is that we have a lot of countries that are aging, but not yet wealthy. So what this graph shows is per capita wealth, and this is logged across here. And then on this side, it shows the share of the 60-plus population. So you can see that we have all these countries in red, and these are countries that are not high-income countries as a whole yet, who are actually reaching the same share of population of the 65 or 60-plus as these traditional countries that we focus on aging. So this would be the Japan, Germany's, etc. So what particular problem or what particular challenges emerge when countries are aging without necessarily yet becoming rich? And here, rich, we focus on per capita wealth. This also takes into account human capital, and that's very much where we're coming at this challenge, because the issue is that in terms of things like health and education, these countries have not yet converged to advanced country attainment rates or healthy life years. And this is really where they face an even bigger challenge for their older population to live long and prosperous lives. So the next graph shows this rather nicely. Here you see the life expectancy at age 50, and this is for females, and this is for males. And you can see Sweden down at the bottom. When you're 50 years old as a woman, you're between 30 and 40 years, you're expected to have a life expectancy. And many of those years, this is shown in this column, are going to be lived without disability in a healthy way. Whereas the worst performer in this is the EU subset of countries, it's Slovakia, where women are expected to live 30 years at the age of 70, but in fact, 2/3 of those years, so 20 years, are expected to be affected by disability or other limitations on functioning. Similarly, if you look at unemployment and inactivity, aging in these emerging European economies often means that you work less or are unemployed. Here we see the unemployment rate for 55 to 64-year-olds in 2011. And you can see in countries like Iceland, you're close to 80%. Whereas down here at the bottom, countries like Turkey, Slovenia, Hungary, Poland, Croatia are around 30%. And so this is a big challenge. It's not so much of a challenge to have people even working after 65, but merely to have people staying in the workforce after the age of 50 is a problem in many of these countries. And over the crisis, the situation has worsened in many countries for these age groups. Then finally, this shows lifelong learning. And this shows basically one measure of lifelong learning, which is education and training, formal education and training programs and participation in them in 2011. And we show two groups here. So we have the 45 to 54 group and the 55 to 69 group. And what you can see is the levels of actually participation in training programs are extremely low. Well below 5% for many of countries and almost 0 for others. In addition, a huge problem that's faced is that numerous people slip into disability. And here we have the 54 to 64 age group, male and females, and you can see this shows this shows what's happening between 54 onwards. You see this very big jump in terms of disability and people leaving the labor force. The pre-retirement population is far more underutilized in these countries than in, say, the more advanced countries that are facing aging. So you can see here that in Japan, well over 60% of this pre-retirement population are working, whereas if you look for in the EU 11, so this is the newer member states in the EU, just about 40+% are working in their pre-retirement years. So this is a very major challenge faced by these countries. In addition, aging is associated with poverty in many of these countries. So here we show the risk of being in poverty for employed and unemployed people of 50 to 64 years old. And you can see for those people who are unemployed in countries like Romania, the at-risk of poverty rate is well over 80%. And Dorte has just pointed out the situation of Bulgaria, where there are a lot of fiscal pressures due to aging populations. But this is something that across the board in Europe, countries are focused on. Here we see aging-related expenditures as a percentage of GDP. This is government expenditures. And you can see that, of course, it's in the advanced economies like France and Germany where you're spending a lot of money. But actually, these newer member states are coming very quickly converging to much higher spending rates. And these are projections done by the countries together with the European Commission of what the picture is going to look like moving forward in the next 50 years to 2060. And this is estimates of, in percentage of GDP points, how much spending is going to increase on these old age programs. And for some countries like Luxembourg, this is about 12% of GDP, but it's not insubstantial for other countries. So the issue is, how are we going to pay for this? One of the ways we're going to have to pay for this is to ensure people have access to the labor market and good quality jobs after the age of 50. And of course, as we've heard, this is not just important from an economic point of view, but also from welfare, for welfare as a whole in society. So does aging entail a bleak future for emerging Europe? Well, our point would be not necessarily. We've seen big shifts in the past in population changes, in behavior, in terms of fertility, for example. This big decline in fertility that we've seen would have been very hard to predict. And this was caused by many behaviors changing due to changed income levels, access to education, etc. So why would we not expect similar behavioral changes to occur given that societies are aging? People will predict this and will change their own behavior. Governments are looking very closely at this and planning policies and interventions. Firms will face the scarcity of younger workers, and so may have to focus on ensuring that they keep the employees they have skilled and working for longer. So for us, we would see really, of course, this aging as an opportunity. As you have a whole extra stage in life that people did not have 100 years ago. And so the idea is, okay, how can people put their human capital to work longer and lead more healthier, longer, more prosperous lifestyles? So our work is really looking at these aspects, and I mean, we're looking at both from the macroeconomic and the microeconomic point of view, but I would say the kind of key strands are how can people stay healthy for longer? How can they participate in the labor market also in their old age? And how can the country's economies and the social models adapt to this aging populations? And why is this important? And here I've just highlighted the emerging Europe experience. Well, emerging Europe's experience matters globally. Where emerging Europe goes, other countries are rapidly following. It took 115 years for France, for the population of France, the proportion of the population in France aged 65 and over to increase from 7% to 14%. So that's shown here. So that happened from 1865 to 1980. And Brazil is expected to make this transition in just 20 years, between 2011 and 2032. And then you have countries like Thailand, Sri Lanka, Jamaica, Azerbaijan that are very quick to follow, and any host. So what's important here is what can we learn about what's worked? Europe and Japan are ahead, emerging Europe is following. What can we learn about policies that have been put in place at the firm level, at the government level? How have individuals' behaviors changed? What types of new policies or interventions do we need to pilot? What type of new social contracts need to develop? And that's very much what our research work is about. And this is directly related, of course, for the World Bank with our many programs across the sectors from education to health to pensions to competitiveness. And so for us, this is a very central agenda for our research, not just in the coming years, but I imagine it's a permanent fixture as part of as the World Bank's challenge in terms of building knowledge. So here, I'm going to focus on a few solutions because we wanted to get away from just presenting the doom and gloom of projections, but rather say, okay, well, have things worked? And point out a few interventions. And we're trying to build a database across all of these different sectors of these type of interventions, because when countries discuss these topics, this is what they want to know. What's worked elsewhere? What's worth trying? What should we be doing? The first example that I'm going to give is on healthy aging. Now this shows life expectancy, or sorry, this shows mortality basically for these EU countries. And the blue bar shows mortality for all causes. And the red bar shows mortality normalized for those EU 11 countries if their circulatory disease mortality was just the same as the EU average across 27 countries. So actually not even a very ambitious type of objective. But what you see is actually what this would mean would be you would eliminate the difference in mortalities that you actually see across EU countries. Because what we currently see is someone in Bulgaria is 1%, for the same age, 1% of the population in Bulgaria and 0.72% of the population in Poland died in 2010 compared to 0.45% in Spain. And 2/3 of this difference is really due to these circulatory diseases. So this is a really big challenge. But there are numerous examples of where countries have managed to bring down their circulatory disease mortality and change behaviors. And the obvious example that many people often give is North Karelia. North Karelia project, the project in Finland, was instituted in the 1970s when Finland faced some of the highest mortality from cardiovascular diseases in the world, and this was the province in Finland that suffered from the highest rates. There is some nice anecdotal evidence on this in terms of why this was occurring. Health behaviors were pretty bad. There was little exercise often built into people's daily life, and in particular, there was a lot of smoking, and their diet was very high in fats, saturated fats, and salt. One story is that when you had people from this particular province doing their military service, they had rarely seen more than 2 types of vegetables in their lives. So they had really never experienced eating fresh vegetables and fruits. So they launched an education campaign and a community health campaign, and that was multifaceted. They had The Biggest Loser television program, and this was this reality TV program where people compete to lose the most weight. That was actually one of their most popular TV programs in Finland already in the 1970s. They had community cooking programs. They had community-driven exercise regimes. They had people really coming together from all strata of the community, from health professionals to housewives, to kind of government health policy employees, but also the general community at large, to put in place these interventions. And what was the result? Well, the result was that they had the most rapid fall in coronary mortality in the world, and it's been seen since the 1970s. And the challenge for many of the newer member states in the EU, who actually suffer from similar challenges that Finland did in the 1970s, is how can they emulate this particular example. Now I'm going to go on to the next example, and this is on productivity. So we've heard from Dorte that actually at the micro level, there's not that much evidence that productivity should be affected because workers get older. But there is some evidence on things that firms can do to enhance or improve productivity for older workers. And this is a much cited example from BMW, was written up in the Harvard Business Review. And this is the BMW 2017 production line pilot in Bavaria. Now, BMW faced the challenge of dealing with an aging but very skilled workforce that was not easy to replace. And so they wanted to see if there were any simple changes that they could make to the production line to actually help these people do their jobs in a way in which they were more comfortable, and also they managed to retain their production rates. So they worked very closly also with these assembly line workforce to identify what were the things that could help them every day in doing their job better as they got older. This was actually not very expensive. It cost $50,000 as a project to adapt an assembly line to older workers. And they did some very simple things, like they gave people different footwear, they came up with exercise regimes, they changed a little bit the routine during the day so that repetitive strain injury was less of a problem. They rotated people across workstations. And what did they find was the end result? Well, there was a 7% productivity improvement in 1 year. And what did this mean? This meant that the productivity of the assembly line staffed by the older workers now was equal to that staffed by the younger workers. So this shows how really one can adapt the workplace to older workers, really to help them maintain and adapt as their physical needs adapt to the workplace and maintain productivity. Then this is another example of now often what we talk about of attracting older people to a labour force. What we talk about often is that you need flexibility really to keep older workers in the workforce for longer because they may have competing needs. For example, there may be care that they're giving at home for relatives or just they require more time off work or longer holidays as they get older and want to make that transition to retired life. So in the US, there's this kind of phenomenon where you have people who move from the north down to Florida every winter for the sun, so they call them the snowbirds. And CVS, which is a major pharmaceutical chain, launched the CVS Snowbird program. And the idea was they had increased needs for workers in Florida in the winter. And so they wanted to attract these people in to work for them, not just because they needed part-time workers, but also because they said, well, these workers were the same age as their clientele, so they could, they knew the needs of their clientele, they could communicate, so they felt that they would be that it would be best to try to attract older workers. So they managed to more than double the number of employees they had over 50 in 1 year in these pharmacies that were targeted by this program. And how did they do that? Well, they instituted new HR practices. So they rewarded older workers for experience by giving them pins to wear and also by asking them to mentor younger employees, I think which is important in recognizing the experience and skills that they had built up. They also wanted the older employees to attend to older customers because they felt that would enrich the experience for the customer. And then they brought flexibility to their contracts by allowing them to work part-time and to move to Florida for this part of the year that was cold. So this was the Snowbird program. And finally, this is a little bit more economics than you probably want in the last slide. But so one thing we wanted to look at was how programs of governments affect people of different ages and genders differently. So we're talking a lot, and you could see in the slides before, about the need for lifelong learning and training and the need for getting people who are long-term unemployed back to work. So we got the administrative data for about 1.5 million people in Latvia and looked over time at the programs. There were 100+ programs that people were participating in and divided it by age groups to see what kind of results were we getting from these programs. So what this graph shows is the effect of participating in an employment or training program on the probability that you're employed 18 months later. And as you can see, for all of these programs, and there's a whole range of programs here from driving, education, to languages, to IT skills, to manual skills, to sales skills, they mostly had positive effects. So these programs were returning people back to work. But we divided it by gender and age groups, and this graph shows young females and young males, and then older, it's 50+ in this definition, females and males. And interestingly, we find different results for different programs. So for example, women gained a lot from getting a driving license for a car. Let's say this. This is older women, 50+. Whereas if we look at the blue, which shows older males at 50+, they actually gained a lot from project management skills. It's here. And also from service and sales and manual work. So here we got some ideas that there are different effects, and here we controlled for other characteristics like education level, previous job, etc. So we're really trying to just capture the impact of these specific programs. But it shows us that when we're designing government programs or government interventions, it's very important to think how they're going to affect and meet the needs of different people of different genders, people from different age groups, and of course there are other characteristics too that are important. So I hope I've given a little flavor of some of the type of solutions and evidence that is coming out from this work, and we're very happy and looking forward to your questions.
Thank you very much. Thank you very much, Emily. A particular feature of Eastern Europe, as you could see, is that they get grey before they get rich. And I'm going to turn now to Dalma to see to what extent that is true more generally around the world. I think Emily suggested some of this already. And in particular, how can we deal with the implications of this for old age security?
That's better. Thank you very much. Thank you for the invitation to participate in this panel, and I'd like to thank in particular the World Bank, who really pulled this together. And I'm grateful to be here today, particularly since I am newly unemployed. I usually have to say at the beginning of every speech that as an official of the U.S. government, I cannot represent the views of the government, et cetera, and today I can really say that because I'm not working. I'm part of the general shutdown. So that is kind of an unexpected experience today. And my second thing I wanted to tell you is that I'm taking a course in Washington on public speaking for managers. And my assignment today for you was to give the speech without a PowerPoint. This is a kind of lifelong learning kind of thing. But I am going to cheat, and I'm going to have 1 or 2. So I probably won't get a grade A. I'll just get a grade C maybe from this experiment. Because I wanted to address 4 questions, and I wanted to have them up before us on the screen because these are questions that, in my experience, when we talked about the situation in Eastern Europe or in other parts of the world, these questions come up over and over again. And the problem is that they're not very helpful questions often. They're stumbling blocks. They're questions which kind of divide the room and don't help us actually to move forward. So I thought maybe we could look at these questions with a hard eye, and if you've got answers to these questions, then you can go back home and talk about these questions in a thoughtful way in order to promote your own national debate on the aging of your populations. Then I would say to you that you are a pension expert, you've graduated, and that you're ready to move on, because these are hard questions. And let me take the very first one. Are pensions like a piggy bank? Now, this is such an attractive idea. I encounter it every day in my policy work. People somehow, and I'm talking a lot about politicians now, have the idea that somehow we can put this money aside, we can take it down in the garden and bury it, and then when we get to be the right retirement age, we can just dig it up and start using it. Well, from a macroeconomic standpoint or microeconomic standpoint, that's a little difficult because there are a lot of things that happen over the course of a lifetime of people, as you well know. People don't save enough. They happen to live in countries where the currency has been devalued, revalued multiple times, which is the case of the Eastern European countries that we've been talking about. You could have done all the right things in Bulgaria. You could have worked all your life at a job. You could have saved. But then when you got to the point of being a retiree, you would find that you did not have adequate income. And you know, this is a challenge for every country. And there is an idea that always comes up, and Johannes, who's sitting here from the World Bank, knows about this discussion that we recently had in a workshop in Washington. And that idea is a kind of intergenerational accounting. That wouldn't it be a good idea if every generation could kind of take care of itself and not pass on too heavy a burden to the future generations? Now, the dialogue, the debate I hear about in Washington, and I'm sure you hear it in your own countries over and over again, is that this coming wave of the aging population is going to eat up the entire national budget for pensions, for healthcare costs, for long-term care services, and so forth. And it's going to crowd out really needed educational expenses, or some people are very worried about defense. So that argument is often formulated, but it's a very tricky argument, and you have to be really careful about handling that argument, because it's probably not possible for any generation to totally take care of itself for its retirement needs. It's about intergenerational solidarity. And we always had it. We had it in the old days with the family, and now we have it increasingly in countries that have adopted a pension system. And that intergenerational solidarity works in order to transfer money among the generations and across a generation. And that's what pensions are about, and that's what we really have to understand. I know it's a difficult economic concept, but I wanted to get the hard one out of the way, and we can talk about it a little bit later with these eminent economists who are sitting up here. How about the second one? Now, both Emily and Dorothea referred to this. Are we doomed because we're aging? Are we going to be less productive societies? Will we have an inevitable decline in our life standards? There's little empirical evidence to that effect. However, I have another warning that's not about that. It's about fiscal mismanagement, which I think is a much greater risk in many countries than the risk of the aging population. Countries can really screw up in the management of public resources. And in the course of tracking how older people are doing across the decades, some countries have actually fallen back. The number of people who are getting protection, who are getting pensions that are of an adequate level, have declined. And that has happened in many of the African countries. It's happened in some of the Latin American countries. And the reason for that is complex. It has to do with changes in the economy and the fact that many workers who used to be in a formal Social Security system have now disappeared into the informal sector. And as we heard in Bulgaria, they've left the country. They've gone somewhere else. So one can stumble backwards as well as go forward. But it's not because we're dealing with an increasingly aging population. I think it's because we're talking about the management of public resources, the effective management. And one of the things, in order to ensure a good, solid pension system in any country, is a basic thing: you have to collect the taxes. If you can't collect the taxes, you are in trouble. And that is a very big challenge, ladies and gentlemen, in many countries around the world today. And we can't ignore that fact. Now, that's my favorite one. What about public or private? It used to be that when we had a panel that was sponsored by the World Bank, I got invited as the token Social Security guy who was supposed to fight for the public system, and they were supposed to fight for the private system. And it was fun, but fortunately, we have moved on. That debate is really not very fruitful because we've realized from real experience now that every country has got to answer that question in a very careful way to fit its own national circumstances. You cannot easily say public is better or private is better. And those countries that are doing the best job, I think, are countries, and I can give you some country examples if you press me during the question and answers, are countries that have successfully put in place a multi-tiered system where they have a public system, they have private system, and people are putting it together. Now, my own country has been working on this for maybe about 60, 70 years. We're not doing such a hot job. because we have about 50% of the labor force that is not doing any private savings. They're not contributing to any retirement fund from their own employment or on their own account. It's voluntary. And voluntary works in some places, but it doesn't work in a lot of other places. So this challenge of putting together a system that really works is very complicated. And it's very important for this part of the world, in Eastern Europe, because we're talking about countries that did not have a long tradition of financial institutions or insurance companies. Those had to be put in place. They had to have capital markets in order to invest the funds that people save. And there has been a fair amount of stumbling. Countries like Poland, countries like Bulgaria, it's not been easy. And the most recent example of a setback is Hungary, which virtually wiped out the second pillar, the private savings scheme. So we're experimenting. We're not there. We don't have easy answers to this question. So if you get caught up in this debate about public and private, be a little careful, because we're still searching, I think, in most countries around the world for the right mix, the right balance, and maybe there isn't a blueprint that works everywhere. Maybe every country is just going to have to figure this one out to fit the very unique circumstances of their own situation. Now, the last question is one which I frequently encounter in my day-to-day work, and that is the prediction that we are going to face a terrible intergenerational conflict. And I've become a little skeptical when that comes up in the conversation about why people are asking that question. Clearly, when you have a country which has a population of only 8% of older people, then you don't talk much about that. When you get into 15%, 20%, which is the case of many European countries, and if you get into Asia, you're already getting 25%, and we'll get to 30%. The question becomes more real. But I've noticed that often when the question comes on the table, it is more to do about the employment prospects for younger people than it is about the aging issue. The frustration of people who ask the question is coming in large part because they're looking at careers which are not the careers that they had hoped for. They've been trained for professions, for jobs that are not opening up for them. And they're angry. They're frustrated because they think that they're not going to get as good a deal as their parents or grandparents. And so the issue, I think, that really we need to pull away the curtain and talk about employment prospects for people who are entering the labor market, who are, as Emily pointed out so eloquently, that group of people who are in that 45-50 range and who are not being employed at the rates that we had hoped. They're falling out of the labor market and instead of going forward. So those are the issues that I think are often behind our discussion. And another one that is hidden behind this discussion about intergenerational contact, and it was briefly alluded to by the previous speakers, is immigration. Because immigration is going to be a very important partial solution to the labor market issues of countries that have rapidly declining birth rates. But it is so difficult to talk about in a calm, responsible way. There's nothing that creates a more heated discussion right away than talking about how many people can we absorb in our country in order to have a better labor market. Now, I have to do an advertisement now, because if you read your newspapers this morning at the hotel, you will see that in the Istanbul press there were a couple articles about a brand new report that's come out from Help Age International. And this report ranks countries about how well they're doing to help older people. Now, I was on the advisory board for this report, and I was very skeptical. The author of the report is sitting in the room, Ashgar back here. Can you raise your hand, Ashgar? He probably will exit very quickly after this speech because you're going to look at the next slide. Maybe not. There we are. You can't read that, can you? But if you could see how your country is doing. And I'm going to take it off the screen. There you are. Because I know everyone focuses on that question of ranking. How well is my country doing? So I would urge you to go to the report and look it up, and you'll see that there were some very important conclusions drawn about the economics of aging from this report. And one of the most important ones for me was the fact that it's not just about money. Just counting pensions and how well people are doing with the pension is only one piece of the picture. If you're going to talk about active aging and how well we're doing with aging, as you heard in the previous discussions, it's all about lifelong learning, it's about access to jobs, it's about how well women are doing in entering the labor market. It's about a whole range of issues, including individual security. How safe do older people feel? Can they vote? Can they participate in society? And the ranking that was devised for this report attempts to take all of these questions into account. Another conclusion that for me I think is relevance for all of us, and that is that in this rapidly aging society where we're so worried about affordability and about solvency, one of the proven ways to get the most bang for your buck is a basic minimum subsistence universal benefit for the entire population. It doesn't cost that much, and it can pull out of poverty a vast number of people who would otherwise be in terrible condition. So it's something that needs to be thought about in a very practical way when you start talking about how much money are we going to spend on the future of the elderly. And then my last point I'd like to make is that I was so pleased that they ended on an optimistic note here about how the aging society is going to do instead of the doom and gloom, because I think that as Emily she said it so well. I wish she hadn't done it before I got there. And that is, society will adapt. These are enormous changes in human history. But I'm quite optimistic that societies will adapt to a society in which we have a much larger number of people who are living. But in order to do that adapting, you need the advocates, you need leadership, you need the policymakers, you need the decision makers, you need the thought people, and that's who you are in the room. Thank you.
Thank you very much, Dalma. I think we can use this opportunity to congratulate whoever had the idea to bring an aging conference to one of the youngest countries in Europe, which is Turkey. I think it's only fitting that in a place like Turkey, you start thinking about a problem that is not yet here, but that is inevitably going to touch Turkey as well. And of course, I'm sure you were quick enough to notice that in this index you rank somewhere in the 70s, which is, by the way, consistent with where Turkey ranks on almost every international comparable index, with the exception of the Logistics Performance Index, where it ranks in the 30s. But most other indices, Turkey does sort of between 60 and 80. So let me open this up for discussion. We've had a vast number of issues touched. We've had issues of distributional arithmetics. We've had issues of fiscal sustainability. We've also had issues of how aging is likely to affect the productivity of our societies. And there are some among economists, like Robert Gordon, for instance, who believes that one of the reasons for us to expect that future economic growth may be much lower than it has been to date is the implication of aging societies. So there are implications for economic growth, but they may not be final. In fact, societies may be able to overcome this. And of course, there are issues of policy that are specific to the problem of aging, whether it concerns healthcare or whether it concerns the labor market, and that are, in a sense, outside of aging. Think of fertility policies. None of the panelists mentioned this, but it's an important topic in places like Russia and arguably also here in Turkey, or issues of migration, which the panelists did already mention. So I'm going to give now the opportunity to you in the audience to ask questions of the panelists. I hope we have roaming microphones, and if we are going to close on time, then we'll take about 20 minutes or so for questions. The gentleman over there. And then over there in the back. Okay, keep your hands up so that the microphones can find you. And I think it would be good, even though you've been together for a few days already, it would be good if you briefly introduced yourselves before you ask the question.
My name is Asghar Zaidi. I'm from Southampton University. My question is about the presentation that Emily made, very useful presentation, but I was surprised and somewhat disappointed that active aging was mentioned as if this is all about labor market engagement. In fact, it is more than that. And some of the lessons that we had drawn from the European Year on active aging and intergenerational solidarity is that we have to look into activity and contribution of older people beyond their labor market engagement. This is a common trap. We economists all fall into that because there is no monetization of such contributions. And I think a word coming from World Bank in such important forum, it is important to at least mention that labor market engagement is not just the only aspect of active aging. Thank you very much.
Thank you. I'm going to take a few, if the panelists don't mind. So the gentleman over there.
Yes, Charles Waldegrave from New Zealand. I lead a social policy research unit there. In terms of adaptation, there was a lot of emphasis upon older people working longer. I just wonder about the panel's responses to two of the problems with that solution. One is the problem of manual workers whose bodies begin to really deteriorate around about 50 and who are often in a really difficult position in terms of work long before they can even qualify for the pension in their own country, so it's much harder for them. And the other thing is the increasing casualisation of work, contracting work, far less security in the labour market than there has been in the past. So I just wonder how the panel addresses those two problems, which are happening throughout all countries, when they're suggesting that one of the key ways of, one of the key adaptations is to work longer, for older people to work longer in the labour market.
Let's take one more. Who has the microphone? Okay, go ahead.
I got it. My name is Bjarne Hastrup from Denmark, from Danish, and I'm the chairman of IFA since yesterday. And I want to tell you something. I am very happy about your presentation in one hand. In the other hand, they are traditional, they are classical, but I need the big picture. What you're doing is to optimize the economic efficiency of aging in the future time. How can we improve public budget? How can we cut back? How can we change the structure? But you forget the big picture. The big picture consists also of the needs and demand for people. Perhaps people in the future time want to step out of the labor market much earlier than you expected. Perhaps they want more security, they want to save even more for healthcare and for hospitals. So what I will urge you to do, and it's all for, it is to optimize, in one hand, the economic efficiency, and the other hand, people's need, demand, and security to get back to the big picture, which I believe would be the future. Thank you very much.
All right, that's a great final question to throw back to our panelists. So I don't know who wants to start. Maybe Dörte, we start with you? Since none of you addressed your question, except for the first speaker who addressed it to Emily. So we'll go to Emily next, but you can choose any of the other ones that you want.
So let me, in the context, what I mentioned was the example of Bulgaria, and really what I focused on here in the presentation was the big picture. Doesn't mean that we have been only looking at the big picture. I would have happily talked 2 hours about all the things we were looking at in the context of Bulgaria. Unfortunately, we didn't have the time. Now, I completely agree with you with the labor market. It's not only about increasing employment rate. There are a lot of different questions, and it's also at the end, I think, for countries like Bulgaria, the key point is that it's important to find a consensus within society what is the right way to go. Is it that, for example, elderly workers would like to have more flexible work arrangement? We found in the context in several countries that actually elderly workers participate or prefer flexible part-time working arrangement because it's difficult for them to spend 8 hours on the job. Perhaps it may be, as you mentioned in Denmark, a preference for more security. But at the end, I think the important thing is to start the debate on this and see what is the kind of vision that the countries have and in which directions they would like to move. And I think our role there merely is to contribute to this debate rather than coming with a vision how things would look like in the future. The same is with the healthcare system. What we see, I mean, I think the example Emily mentioned in terms of the Finnish program is very illuminating. And if you look at Bulgaria, she showed, I don't know if you saw it, but on the graph on cardiovascular diseases, Bulgaria is right on the left side. It's a large share of men in the age of 50 to 60-year-old in Bulgaria who die of cardiovascular diseases, which could be presumably, if you look at Finland, easily preventable if prevention would be scaled up, if information, better information would come out there. So there are definitely, I think many of the points raised there are important, and they will benefit a lot of they won't benefit the elderly of today, but if they start being implemented now, they will definitely ensure that the elderly of the future can have a better standard of living and a better quality of life, per se.
Okay, Emily, why don't you address the question on aging is not just about labor markets?
Thank you very much. No, thank you for making that point, and I think it's a very important one. Here we really were presenting some of the stark labor market facts for emerging Europe, because I think it's very important to think it's not just about trying to make people work till 67. It's about trying to get people to have access to good quality jobs from the age of 45, 50 onwards. And these are the trends that we're seeing. We did some work on individual countries, and we see over the crisis that about half of those who've been in low-paid jobs, are temporary jobs, are no jobs, or who've left the labor market are older, unskilled workers. And the legacy of that for them, it's not just something that concerns us in terms of a fiscal sense, but also there are a lot of mental health implications. So what we've also seen is that over time, if you look actually at the data within countries, these people often slip into disability programs. We see a lot of evidence from the shared data also on low quality work being associated kind of with mental health. So people, I agree people want to retire at some stage, but at 50, many people still want to be actively engaged in the labor market. So I do think that the labor market participation question is very important. But of course, this is not where the contribution of the older population stops. And there is a lot of work and evidence already on the caregiving that, and we often call them the squeezed middle, but the squeezed middle are getting even older, where they're looking after their parents and they're looking after their grandchildren often at the same time. So there's a lot of evidence on the amount of free care that's been given by these people and unpaid work that they're doing for society. And we're actually trying to collect that data for a series of countries where it's not available, so that we can make sure to make that clear. Because there's a lot of discussion of particularly raising participation of older women in the labor force, and I think that conversation cannot happen without looking at what kind of free services they're providing to allow their children to participate in the workforce. So I completely agree there. So their contribution, of course, goes way beyond the labor market. But in looking at labor market participation, I would say it's not just a fiscal question, it's really a question for the individuals themselves. And we've done some qualitative work where we've talked to older unemployed people as well, and it very much comes out that they're often very despondent at the biases that they face in the labor market and the difficulty of getting a job in many countries after 50, particularly if you come from the lower skilled segment. So I would argue that this is really a welfare question, not just a kind of fiscal sustainability question. Then thank you very much for the comments from our Danish colleague. I think on the big picture, it's very important to step out, of course, of the labor market. And even within the labor market, these issues of flexibility must be brought to the fore. You can't have one model for everyone, and you can't have one model for every stage of the life. And I would argue, as a woman in her 30s, that perhaps the idea that, this should be the peak working life when, if you step out of the labor market, you get into a lot of trouble further along the line in terms of what happens to you in terms of your wages and advancement is also something we have to look at. So we maybe have to look across all stages of life and think how the labor market can best adapt. And we very much want to look at how flexible things like the health system and the education system should be to the needs of the older population. So for example, one thing that really concerns us is the institutionalization of older people in long-term care scenarios in many of the countries that we work in, and how can incentive be created to allow those people to remain in their communities if that's what they want to happen. So this is a very important part of the work program. So thank you very much for all your comments.
Dalmer, there was one question on what happens to manual workers from the gentleman from New Zealand that I don't think we've directly answered. Do you want to have a crack at that and then answer any of the others where you feel you want to add?
I think you put your finger on one of the most intractable problems that we're facing these days, and that is that there's a sharp dropout of the labor market of men over 50 in most countries. And it's clear that they were trained to do jobs in factories and production and so forth, and those jobs are disappearing, and they don't have the skills to do other jobs. So they end up primarily on the disability roles. We have a crisis in the United States, an absolute crisis on our hands. The roles are exploding, particularly with this category. And what makes it, I'm going to get even more frank with you. What makes the problem even more intractable is that if you scratch those numbers, you will see that minorities and certain ethnic groups are doubly at risk because they had these low-paying jobs, and they are the first ones to be shoved out. So, you sit around in a room and you talk about people extending their employment by choice and so forth. I love these discussions because they're usually university professors who can do as they damn well please. But this group doesn't relate to that problem. So the most innovative thinking that I've seen on this issue is coming from some of the Nordic countries and from the Netherlands, where they sort of said, okay, these men, unemployed youth, people on social assistance, you know, they've all got the same problem. They all need to get back to work. And let's just try to break down these barriers that we've established, where we say, well, these are the disabled, you know, unionized guys, and over here are the youth and so forth. That isn't working. We're talking about people in all stages of life who need all the help they can get to re-enter the labor force. And that means very intensive training efforts and follow-up, or else they just drop out. And once they are on the disability rolls, it is too late. They never go back to work, less than 1% in most countries. Once you've told the person, you're disabled, you've got a benefit, and it's over. It has to be all in the, whatever we call the front end of this process, but solutions are not easy. And now we'll have a discussion out of the room, I think, about contract work. You know, I'm kind of in favor of it. I think it introduces some flexibility in the labor market that helps perhaps older workers. It's not all bad. I think that's an opinion. Now, Bjarne, the big picture. I think I would be really interested in discussing with you what you think the big picture really is. Because for me, to get to the big picture about what people want as they grow older, they have to have some security, they have to have choices, they have to have empowerment. And that means that they have pensions, they have health care, they've got access to good public services. And that is only the case in a very limited number of countries or in the index. It's actually a rather small number of countries. So I don't think those countries are into the same discussion of the big picture that you might be or I might be, coming from countries that have a mature system. I think the statistics that the ILO puts out is only 1 in 5 workers in the world has any access to a pension. So what is the big picture for the 75% of the world's population? I think the building blocks are economic security, health care, and then this empowerment that comes from that to give people the choices.
Okay, we have time for a second round of questions, I believe, over there in the front. Maybe we can have the lady first, please.
Thank you for nice and useful presentation of the group panel. My question from the Emily is about the, as you mentioned, about the under pressure of the expenditure of aged care services around the world, and also the burden of the elderly people and their family members to pay out-of-pocket money of the aged care services and expenditure. And as on the other hand, there are some group of countries, especially in the Middle East countries, that there is no pension system, there is no social security system on there, so elderly people and their family under pressure. So it seems that for this group of country to set up and run up the carer services or family member caregiver or informal caregiver is one of the important issues that should be attention on it. I want to know that is there any specific programs to expand it of the carer services as the informal care services in this regard? Because, for example, in Iran, 90% of our elderly population living with their family members. And you see that the bulk and for elderly people living with there, and we have a huge number of informal caregivers as a human resources. And I'm sure that in other Asian countries, or especially in the Middle East, we should follow this pattern. So if we have find more attention in the informal caregiver system, should be useful. Thank you.
It's an excellent question, if I may, from the chair. Of course, my observation in Turkey is that the informal caregiver is very often the woman. And as a result, Turkey has one of the lowest female labor force participation rates, and that in itself has productivity implications. So when you address the question, I'd be interested in the trade-off between caring at home and having more people participate in the labor force, and then generating through a socially or a public administered system the old age care. I think there's some real trade-offs involved, but I don't want to monopolize the discussion. Over here first, and then we'll take a third question over there.
Hi, Alex Ross, World Health Organization, based in Kobe, Japan. Thanks very much for the presentations, and indeed to recognize that it was very much focused on labor economics and on a certain set of countries. We're actually quite interested in driving innovation for aging populations, but if I was a strategic planner for a company in India or Brazil or Russia or China or Japan and so on, or similarly if I was a public health planner or Ministry of Finance planner, there's a set of data and economic arguments that's still missing, which is looking at different scenarios about what are a bit more complex issues of maybe purchasing power, but it's also what companies and others are looking for in terms of signals about getting into a market, or what is the potential of that market, or similarly, what's the potential for effects on healthcare costs, keeping people at home, and so on and so forth. I'm just curious to see if the bank has actually done any work on this at all that goes far beyond the kind of labor economic picture, which is necessary, but it's limited, or if any other places that you know who've done that kind of analysis that would be helpful to those types of planners. Thank you.
Okay. We'll take you as well, since we'll take two more. So first the gentleman and then the lady in the back. If you just pass the microphone once you finish. We'll take you both, in whatever order you please.
Thank you so much, Mr. Razor. I'm Adnan Ağırbaşlı, President of YEBAV, Foundation for Elderly and Disabled Care, Education, and Research. And we're working in partnership with municipality, Selçuklu Municipality and Selçuk University altogether. And Emily has pointed out Turkey's great problem. Syndicates want earlier and earlier retirement. But Turkey is second worst country on the world as far as elderly unemployment concerned. What we are trying to do is to have elderly in one side and disabled on the other side, teach them, employ them to educate to an extent which wouldn't get them so tired. They can keep on working on their previous professions or learn new professions, or have a small garden to raise vegetables, or raise chickens. We'll buy all of them. We'll promote them. What we are trying to do is none of our residents will be unemployed. Everyone will be employed. If you would mind to visit our stand, I will explain in detail, and I want to ask you whether this would be a pilot project for this problem. Thank you.
Thank you very much for adding to the examples that Emily had in her presentation. I think you can add another slide to it after you visit the stand. Let's have a final question over there and we go back to the panel.
Okay, thank you very much. And I love that comment, and I have to say I really like Alex's question, so I'm looking forward to hearing the answer to that. I'm interested in what research, if any, you have done or are doing in the area of the impact of work-based productivity levels arising from people's duty of care to their own family members, particularly their own older parents, and while they're trying to cope, while still at work and possibly guilty of high levels of presentism, but not productive engagement. So what do we know about the impact on productivity of the absence of strong care supports outside for older family members?
Great. We'll go in the same order. Dirta, you get to start. Choose any question, then we'll go to Emily and we'll finish with Dal.
Let me start with the two questions on long-term care, which actually my colleague Johannes is one of our long-term care experts experts in the bank. So Johannes, please chip in if you think there's anything important to add. But we looked into, and Johannes did a great study actually on long-term care in Bulgaria with such a very low level. And so it has the non-existence of long-term care has several implications. One is what Martin mentioned, that it affects the labor force participation rate of women. So in Bulgaria you have a combination. You don't have existing long-term care facilities, and you have one of the highest paid mandatory maternity leaves in the world, which means that women are long times out of the labor force. And you have many of the women that actually do not acquire pension rights. So when their husbands die, it's very difficult for women actually, they heavily have to rely on social assistance because they don't have access to pension rights, and poverty among elderly women is actually quite high. And that is then aggravated by the fact that of very high out-of-pocket expenditures on medicines, which are extremely high in Bulgaria, and sometimes even for those who receive pensions, 1/3 of the pension incomes actually is just used for paying medicine. So this is clearly a very big problem. The other thing about the non-existence of long-term care is then the implications for the healthcare system, because if you don't have long-term care facilities available, it means that a person, an elderly person, for example, that breaks a leg and could be treated in a rehabilitative care center is treated in a hospital instead. And it's probably not the most comfortable setting for the elderly person. It's a very costly setting, and it's also the risk of infections, etc., is much higher. So building up a long-term care system will benefit. It is kind of a win-win from that perspective. It will allow to provide much better and much pleasant care to the elderly, but it would also take pressure off the healthcare system. Now the question is then, okay, if you want to think about long-term care, building up long-term care system, who is going to take care of the elderly? If you have a family that can take care of you, it's probably the nicest thing for the elderly. In countries like Bulgaria, it's difficult because immigration has been very high. A lot of young people have actually left the country. So where should this setting take place? And one thing that seems to have been quite successful is to build community-based long-term care centers, which would kind of free up, put less pressure on labor force participation rates of women, but nevertheless would provide to the elderly a kind of familiar setting and would allow them to stay in the community within which they have grown old. So that's kind of one of the ideas that have been explored here. Thank you.
I think Duarte effectively answered this long-term care question, but I'll just add to it in that so what we do see is that there is very little community-based long-term care in many of our countries in Europe. This specific context in Eastern Europe and Russia allows us maybe to find some savings or gains from hospitals to be redirected towards long-term care in the community, because as Dorota said, you're more likely just to be hospitalized and re-hospitalized with things that in other countries would be treated at home, because basically the National Health Service in many countries pays for your hospitalization, the local community pays for your community-based care, and there just isn't provision at that level. And the issue is to create an incentive for you to kind of streamline this type of care and hospital discharge management across these different levels or agencies within the government to provide not just, I think, more cost-effective care, but also the kind of care people want, which is, you know, when people break their hip, it's not only better for hospital costs that they leave the hospital quickly, it's better for them, both in terms of their psychological well-being and how quickly they get better. So I think that's something where one can really work on, and that's in the emerging Europe context, really, to free funds for community provided care solutions, which would free up the time of these unpaid caregivers also, and perhaps allow them to not leave or go part-time from the workforce. Of course, this is country-specific, and we're talking about cases in emerging Europe. And there are, you know, as Dalmor was pointing out earlier, there are, you know, whole great areas of the world where there's a huge amount of under-provision of everything from pensions to basic social assistance from elderly people to care, you know, medical. I mean, this pension may not be there even for you to pay a third of it for pharmaceuticals, and that's a huge issue. And I think in the bank we have many programs going on in different countries, but very much from a kind of social safety net point of view. So looking across all generations and seeing how it is that you need to provide support for those who are vulnerable of falling into emergency situations or who have long-term structural poverty issues. And I think as the society ages and also as social structures change, and perhaps in many countries with urbanization and change in fertility, it's going to be much more difficult to rely on your children or grandchildren to be caregivers. And so the state may have to step in. And I know in China, this is certainly something that the government is very much thinking of. What is the group of policies we should be, our programs we should be providing for our older population? What care should we be making sure they have? What care should their family be giving? What incomes should they be getting? And they're very much looking at the experience of advanced countries with some trepidation, because they don't want to necessarily go down that route. They find it, you know, the fiscal weight of some of these programs quite concerning, but at the same time, given the rapid aging, and as we saw, these countries are aging like we never saw before, these policy questions are very important. And thank you very much for the information on the pilot project. So I'm going to visit the stand and find out more about it. And yeah, I'll leave it there just to give Dalmor a little bit of...
I just have two quick reactions to questions that were posed. One was on paying family members to provide care to a family member. And there are people in the room who are much more specialized in this area than I am. But it's a debate that has been going on for many years about whether, if you pay a family member, would you actually discourage people from doing it voluntarily? Would it affect the family in a negative way somehow? But the experiments that have been held in the United States at the state level are just the opposite. When they provided some small payment to a family member, it gave more of a choice, primarily to women, of whether they were going to be at work and employment or whether they would stay at home and help the family member. And one of the most interesting outcomes that was quite unexpected was there were, in some places in the United States, there was quite a high number of ex-spouses who stepped forward. The divorced spouse who said, I'll take that money and I can take care of him, usually him, because after all, they know each other pretty well. So it shows you that the family can evolve in quite amazing ways. And that leads me to Alex's question about strategic planning. I don't know, we're not doing the kind of strategic planning that you're talking about that would help companies. I think that's quite not very appropriate for the government. But we're putting in a lot of resources into strategic planning about the family and households, because it's very clear that in most countries the households are shrinking. There are an increasing number of single parent-headed households. They will be aging as single parents, and they'll be living on their own, or we will see people living in new kinds of family settings. Because of high housing costs in urban areas, it's very possible that you will see grandparents and grandchildren living together, and maybe a divorced spouse or whatever. So there will be all kinds of new compositions for households that will require different thinking about housing, about transportation, about the services that are provided by the community. So I would say it's more around that household composition that you see the interesting strategic planning work going on.
We're going to have to leave it there. Thank you all very much for the attention. Thank you to the three panelists for giving us some things to think about. The macroeconomic picture, if you look at it as an economist, it's a dismal science. But once you start looking at the microeconomic picture, there are lots of examples that seem to suggest that we can leave for the next session in a more optimistic mood. So with that, I wish us all continued fruitful discussions and thank the panelists and the organizers once again. Thank you.
This afternoon,